Hey, so as you can see, I'm having issues with my eye, and it is the direct product of mucus fishing syndrome. When I have a flare up, this is typically the outcome, though it's usually in this eye rather than my right eye. Usually my right eye is pretty well behaved, but whenever it flares up, it's a lot worse than my left. So I'm fucking struggling, y'all. I'm struggling. Like, honestly, so my HS has been getting progressively worse and worse as time has gone on. And it is like all maladies that have, continued to be a problem for me. It's the product of stress. It is exacerbated by stress. This is exacerbated by stress. My armpit is exacerbated by stress. My depression, exacerbated by stress. And so I have, over the past couple months, been in and out of the doctor like a lot, like a whole fucking lot. And I'm sorry, y'all. It's so bad. It's so irritating. You can see how like red my eye is, and maybe I'll show you what it looks like because it's not just mucus. It's not just like, strings of mucus that I'm pulling out of my eyes. It's not just that. It's like sheets of like thick, almost like dried mucus that's stuck to the inside of my eyelid. It's kind of horrific. Um, and peeling them off with tweezers is well, it makes me fucking cringe to think about, but that's what I do. Uh, but it's hard to concentrate and talk while you have like just constant irritation in your eye. I'm just gonna close it. I'm just gonna do this because this is better. I can't fucking see out of my left eye, but at least I'm not I'm not fucked up. I've been in and out of the doctors a lot these past few months. Like in October, I had to go to the gynecologist to get a biopsy done. I got a biopsy done, y'all, and it's because I have this mass growing in my vaginal wall, and it's on both sides. And so they initially thought it was a Bartholin cyst, and when they cut it open, um, there was nothing that was coming out, and so they're like, okay, maybe it's something else. And so they decided to have me get an MRI done, and it came up as just clusters of masses that are down there, um, as far as the MRI goes. And so she did a biopsy of it, and I will tell you that is one of the most painful experiences I've ever had in my fucking life. They numbed it. They numbed it. They tried to numb it, but it's really deep in there. And so when they're taking the biopsy needle that is bigger than a regular needle, like bigger than a regular syringe, it's it's huge. And they took this biopsy needle and they shove it into my vagina. They literally shove it in there, and for whatever reason, there's like a capsule around the growth that's down there. And so the technician guy that was doing it, he had to push really, really, really hard. It hurt exquisite amounts. It was horrible. It was absolutely horrible. They did the biopsy, and they also did a karyotype because they weren't sure, maybe I have fucking testicles. But it seems like it's just masses of maybe scar tissue, maybe they don't know. They really don't know. So I went to the dermatologist today because of course also my HS is become worse and worse over time, and I wanted to look into what kind of interventions I could do to prevent my HS from being as debilitating as it has been becoming. And it's just all my trips to the doctor are mired in an experience of just overwhelming discomfort, pain, and disappointment. And so when I went to the dermatologist today, um, I was looking for options as far as interventions go. And this is a dermatologist that studies specifically HS. And she wasn't there. The doctor herself that I meet with usually isn't there, but her PA, her physician's assistant, who is pretty much just like a nurse practitioner, they're very, very knowledgeable of, I mean, they're pretty much just like doctors. They're like nurses on steroids. They're pretty much just doctors, because they get to see a lot of cases. They get to interact with patients more than the doctors do, because the doctors are, there to do like the serious shit, while nurses are, the more base level things. And so they have a lot of knowledge. And this PA, she wasn't all that helpful, and I was really disappointed by it. When I came in, I told her that I was looking to do some kind of intervention to prevent my HS from being as bad in the future. And she was like, "Yeah, you're definitely a candidate for the surgery." And the surgery is invasive as fuck, y'all. They have to take out a skin graft from my thigh, which is, it's about the same size as my armpit. It would need to be like this big. So I would have a scar on myself, on my leg, this big. And then they take that skin graft and slap it in my armpit after removing all of like my hair follicles and my skin and the scar tissue and the tracks that are in here. And it's no guarantee that that's going to work. Like, the skin graft might not take, but also they might not have gotten everything out. And it's a really long recovery time. It's really painful. It's really strenuous. It's really difficult. And so I was trying to do something short of that, because that's a lot to go through. It's a lot to go through for any person. And my HS is not under control, but it is not as bad as a lot of people's. I'm not like in stage 3. I'm only in stage 2. And so I was hoping that I would get some options as far as things short of that surgery go, because there are definitely options out there. And she didn't really have anything for me. And it was really weird because, like, when I'm talking to her, I'm like, okay, well, what are the things that I can do? And she's like, you definitely should do the surgery or look into doing the surgery. And I'm like, okay, anything short of that? And she's like, no, not really. And I'm like, what about electrolysis? What about getting all my hair removed? She's like, oh yeah, no, that's a thing. I'm like, bitch, those are the things that I'm asking you for. So why, I shouldn't have to tell you of the procedures that I'm interested in looking into. You should know these things and tell me. And so there was really nothing to be gained as far as getting more information about my HS and taking care of it in the future. It seems like that's a thing that's just going to be on fucking me, and that's a scary thing to be confronted with. To have to take um, your medical care into your own hands as though I'm a fucking doctor. I'm not a doctor. I mean, I'm not a layperson at the same time. I have a fair amount of knowledge about how the body works and all that kind of stuff, but you're kind of looking to professionals to help you to make a decision that is informed by professional knowledge, by expert knowledge, by extensive knowledge of the subject matter. And that was not something that was given to me today, and it was very disappointing. I also talk to them about, because I do have flare ups in my groin region, and I don't think that this biopsy thing that I had done, like in my vaginal wall, I don't know if it's exactly like HS. It might be a complication of HS, but it's not a boil because it doesn't have anything in it. There's no fluid that comes out when the doctor tried to lance it. And so what this doctor did with this the physician's assistant did at the dermatology office, she numbed it up, and she thinks that it's actually just scar tissue, which is possible. It's absolutely possible. But they didn't really get to the bottom of it. As far as the gynecologist who took the biopsy, they don't know what it is. No one knows what it is. And it's not malignant as far as they know. But no one knows what the fuck it is, and it is so frustrating just to be volleyed back and forth between these professionals that don't know what the fuck they're doing. Um, but in the case that it is a complication of my HS, it is possible that I had like boils down there, because I've definitely had boils down there in the past, and then I have a new one that's down here that feels very similar to this thing that needed to be biopsied. So I'm thinking that I had a boil down there and then it went away and it caused scar tissue to form. And that's what's going on as far as because it's not painful, it's just pressure, and it's definitely like a mass. And that's what happens when I have a well, like a series of flare-ups in one area. So like with my armpit, where like we have masses of scar tissue, we have tracks down here, we have just a lot of scarring going on. But it's weird because this is years of this happening, like several occurrences, like countless occurrences of having flare-ups and boils and all that kind of stuff down in my groin region. I really haven't had that kind of situation. And so it's weird that so much scar tissue would form from just one or two instances of having a boil. It's, well, it's really disconcerting. It's really kind of worrisome. It's distressing to think that like I need to take such good care of down here, because if I have one mistake, if I have one slip up, if I have one boil, one ingrown hair, then this could cause just masses of solid scar tissue to form. It's almost like that bone disease where like if you get injured, your body makes more bone tissue, more bone matter inside of you rather than, scar tissue. But this is with scar tissue. And so I'm just becoming like a fucking mass of scar tissue, and it's so stressful because it's uncomfortable. It's uncomfortable to sit. It's uncomfortable to do any kind of exercising because the way that exercise equipment is, it's not really ergonomic to, you know, cradling your vagina. It's just flat usually. And so it makes sitting uncomfortable. It makes sex very, very uncomfortable. And it's a frustrating thing because it's like I already don't enjoy sex in the first place, so why would it even fucking matter? And I can't think that way because I deserve to not be in discomfort at all times. I don't know. Yeah, I'm just really at the end of my rope here. And I don't have insurance that covers the specialist that I need. And the insurance that I have, they don't have a whole lot of doctors who are well versed in HS, and so they end up like hacking up these patients, and they'll come back to the specialists that are more versed in HS, having been pretty much butchered by these surgeons that don't know what the fuck they're doing. And it's just a really frustrating situation, and I'm having a hard time really just getting through it day to day. Yeah, I don't know what to do.